countries. And I think what Melinda said, of course, values is important, the development, research, but money counts. We need more money, and I think that's where we are. ACT-A has done and delivered impressive results in a short time. We are close to effective vaccines. We have promising rapid tests, constantly working effectively Activate to find new solutions also on the distribution. But the total funding gap is still $28 billion US. And we need 4.5 billion for urgently to continue the work to make sure that we are following the steps now, that we are managing the direction. And we have to look beyond aid for financing. We can't just put out all the development aid budgets and use that money. We need to look at the private sector. We need to look at innovative mechanisms. We need to look at other ways to get this money up fast, because we need to accelerate this faster than we are doing these days. Of course, we are using a huge amount of money, all of us who are leading different countries, on balancing our economies, making sure that the economic hit isn't that big, transforming our economies into building better after the pandemic. But it will be a longer time until we really get after the pandemic if we don't now put up money for new solutions. We need money to have equitable distribution, to make sure that we are the immunization is reaching out to everybody. I think it's a human rights issue as much as not only a global public good issue. It is, but it's also a human rights issue. And I think ACT-A is on the right track, but we need to increase countries and companies and private sector representatives' participation in the work to finance even more. Norway, South Africa, and the European Union and the World Health Organization will reach out to the G20 and ask for their leadership in getting necessary funding for ACT-A. If not more money is put up by countries, we will not reach our aims. I think it's a great and big significant what we have heard both from President Macron, from the European Commission, and from the Gates Foundation today. I, in fact, have just taken a break from a cabinet meeting to join this panel, and we are in this meeting discussing our further contributions to ACT-A. We have contributed $65 million US already, and but we are planning to increase substantially our commitments to make sure that we are having enough money to continue the speedy, rapid development that we are seeing. So, but we also need to see other countries, and we need to see that this should be looked upon as part of your economic recovery, because your economic recovery becomes quicker if the whole world quicker comes out of the pandemic situation. And if you really count the numbers that we are using on stabilizing the economy and financing the future and trying to develop competitiveness and building back better, I think $28 billion US is not so much. It's in fact a large number if you look at it from a perspective of aid and health financing, but it is not a large sum of money if you're looking at it in the economic perspective of what we are losing every day in gross national products falling all over the world. When people are losing their jobs, to get out of this situation, we also need to make sure that everybody gets out of the situation, and that's why we need to finance this better.
Mr. Solberg, thank you very much. I'd love to put some of those thoughts, what we've just heard from Erna Solberg, but also from Melinda Gates a moment ago. I'd love to hear, Ursula von der Leyen, what you think about that. The idea that, in a sense, so many of these arguments have been, one, appear intuitive to people, that this is the only way that we can avoid further losses and further deaths and a pandemic that isn't under control. Tell us about the Commission's contribution and why you had decided to play such a prominent role. And again, picking up on the comments that were just made, to put money behind those commitments.
Yes, so the story of Accelerator started indeed in spring and President Macron and Dr. Tedros talked about it. Friends from the United States actually called me and asked the European Commission to join and to show leadership on convening the different stakeholders. And indeed, it's a convening momentum, a convening power that you need. And if you look at who is in or working for the ACT Accelerator, we have more than 40 countries now. We have the WHO as an important multilateral organization. We have organizations like CEPI in it, but also the foundations like the Bill and Melinda Gates Foundation or the Wellcome Trust, just to name some. And we have fantastic co-chairs. This is, you've just heard and seen Erna Solberg and Cyril Ramaphosa, the president of South Africa. Why do I describe that? It shows you need many. And we were also strongly supported by civil society and NGOs, for example, the Global Citizen. So you need many to really step up, build this new construction and raise money. We had 2 pledging rounds where we raised 16 billion, but Erna Solberg is right, this is not enough. And Melinda Gates also said it, this is not enough. Erna, you said you now need 28 billion more for the ACT Accelerator to fulfill its objectives. I just want to remind us all that 28 billion, well, that's the same sum the transport sector and the global tourism sector lose in just 2 days of lockdown. So there is a very clear message behind it. It's way better to invest now in the ACT Accelerator and in COVAX for the distribution in every corner of the world of vaccines, than to have to struggle longer with all the confinement measures we have suffered of during this pandemic. So I really welcome, and it's really good news, the contributions that have been announced by Melinda Gates and by Erna Solberg. So the Commission also will contribute another 100 million to the COVAX facility. In the COVAX facility, it's so outstanding that you have 186 countries that come together, and we have one pillar for the higher income countries and the second pillar where the low and middle income countries are. And we expect the high income countries to finance the vaccines and the deployment of vaccines for low and middle income countries. That's what COVAX is for. So it's enormously important also to support COVAX, where Gavi, with an enormous knowledge, is distributing or is ready to deploy the vaccine to every corner, every village of this globe where it is necessary. I think this is a strong case for stepping up together, for really calling for solidarity. It's in our common interest. It's the first time we've done that in such a way together, but it's the very first time that the world has to fight such a global pandemic, and it's worth to show that we will overcome this pandemic with solidarity and joint action.
Madam President, thank you very much. I think really interesting there to look at the cost of inaction when we're trying to look at the cost ahead in terms of action within this particular mechanism that seeks to bring these vaccines globally and equitably. Dr. Tedros, I'd love to ask you, having heard everything you've just heard, how confident you are that this can be done?
Yeah, thank you. Thank you so much. I mean, this pandemic is unprecedented. And it has taken the whole world hostage. And the only option we have is cooperation and solidarity. As has been said by all speakers, Ursula, Melinda, and also Erna Solberg. I fully agree. So it's a must. And I think the world is seeing it that way. And I really like what Melinda said. Self-interest and selfless are the same. So for any individual or any country, the sharing is something they do for themselves. It's in their own interest. So that's why I think the world is realizing that and moving in that direction. And also, as I said in my speech, there are some problems we see with some countries, but by and large, there is a consensus which is really coming up strongly, and the world speaking or saying the same thing. But I hope we will keep the momentum going and show true commitment, and that commitment should be seen in action. We have now good news, one vaccine which is already announced and very promising, and we expect more vaccines, and we hope there will be a good production capacity to have a good number of size of vaccines to distribute to the priority groups that we have identified as part of the allocation framework. But to sum up, this is a coalition of multilateral organizations, governments, civil society, the private sector, and I'm really convinced, and I'm optimistic that we can implement the Accelerator. So thank you so much again to all who have joined today. An excellent group that has been on the front from the start. The reason behind the success of the ACT-A are those who are participating today in this panel, and also others who are working day and night from all the institutions that we have already mentioned. Thank you.
Doctor, thank you so much. We're really grateful to you and to all the panelists. Such an illustrious panel today, and so many important voices that have allowed us really to measure what's been achieved and also what lies ahead. Thank you all for joining us in this session this afternoon. Such a pleasure to see you all in one place on such an important issue. Thank you so much.
Thank you.
Thank you.
We're going to hear now from the Spanish Prime Minister. A number of voices, of course, very important in the search for a way, a mechanism that will bring these vaccines to the world in a way that is at once global and equitable. Here's what Pedro Sanchez had to say.
We launched the ACT Accelerator just 6 months ago, and it has already made great achievements since then. We should feel proud about it, but there's yet much to do to ensure the ACT's effectiveness. We're still in the midst of the pandemic, and the fastest way out will be through effective, safe and accessible vaccines, treatments and diagnostics. If we manage to develop effective vaccines against COVID-19, it will be much more than what has been achieved with other diseases. Let's remember that there is still no vaccine for malaria or HIV, and this is actually happening in record time. But the real challenge will still be to make these vaccine treatments and diagnostics available across the globe. For ACT-A to meet its objectives, its goals, we need as many countries, as many private actors as possible to join. We should also keep the momentum to close the current financial gap. Spain has supported the ACT-A from the start because we know that we need to work together to end this dreadful pandemic. And we will continue to spearhead these efforts. This is why I'm happy to share that the 50 million euros Spain announced in May for Gavi will be allocated exclusively to the advanced market commitment for COVID-19 vaccines. This mechanism will be critical to ensure the production and distribution of vaccines in low and middle income countries. So I hope today marks another milestone that garners even more support from all around the world.
Pedro Sanchez there on Spain's contribution to ACTA. He has, of course, been on the forefront of one of the fiercest battles in Europe against the pandemic. Another leader who's been on the front line in Europe has, of course, been the Italian Prime Minister.
Since the beginning of this pandemic, Italy has called for a multilateral and multidimensional response based on international cooperation and solidarity and guided by science, medicine, and innovation. The upcoming second wave of the pandemic demands all governments to take again difficult decisions and requests important sacrifices from our citizens. Yet, national solutions are not enough. We must continue to focus on international partnership for a simple reason. While the virus knows no border, we can fight it efficiently only if we join efforts to limit its circulation and to identify the most effective remedies. The Accelerator, the most important multilateral cooperative platform to ensure universal and equitable access to diagnostics, therapeutics, and vaccines, is the best example of this international effort. And Italy is proud to have been among the very first to contribute to the Accelerator, especially focusing on the COVAX facility to the benefit of the most vulnerable countries. Now we must all step up to close the remaining financial gap. Providing global access to health services is a moral, political, social, and economic imperative. It's also clear that fighting the virus is instrumental not only to saving millions of lives, but also to overcoming the heavy socio-economic effects of the pandemic. We should not underestimate their importance, since they can be deeply disruptive of the social fabric of our countries. We welcome the recent news coming from research on vaccines. We are confident that science, medicine, and technology will deliver the health tools we need. It's now our responsibility to ensure that once available, we will be ready through their safe, effective, timely, and equitable distribution all over the world. It's a huge challenge that requires very accurate planning. The incoming Italian presidency of the G20 will put global health at the top of its agenda and is fully committed to advancing and supporting the fundamental work of the Accelerator. Together with the European Commission, Italy will also host a Global Health Summit in 2021, which will focus on our response to the pandemic, on the financial support needed by the Accelerator, and on the goal to build resilient national health systems. Humanity needs leadership and solidarity to defeat the coronavirus. Italy stands ready to contribute to this common goal. Together, we can move out of the corona world and turn it into a collective, better destiny for us and for our children. Thank you.
Giuseppe Conte there on why this pandemic and the necessarily global answers to it will be at the heart of the priorities for Italy as it takes over the rotating presidency of the G20. We're going to listen now to the Foreign Affairs Minister of Saudi Arabia, which of course currently holds the presidency of the G20, to have a listen to what he thinks about the efforts so far and what more needs to be done.
Your Excellencies, ladies and gentlemen, at the outset, I would like to convey to you the greetings of the custodian of the two holy mosques, King Salman bin Abdulaziz, and His Royal Highness Crown Prince Mohammed bin Salman, and their best wishes for a successful outcome of this summit. I also would like to express our thanks and appreciation to President Macron and the Republic of France for hosting this important gathering at this important time. And finally, I'd also like to express our appreciation to the Secretary General of the World Health Organization and to the World Health Organization for the tremendous efforts that it has expended in dealing with this COVID-19 pandemic. Saudi Arabia hosted a summit of the G20 earlier this year, chaired by the custodian of the Holy Mosques, King Salman bin Abdulaziz, in order to show our commitment to dealing with this pandemic and our desire to work very closely with our partners around the world to find a solution to it. We are committed to working with our partners around the world, and we will continue to do so. The Kingdom has contributed $500 million to the efforts globally so far, in addition to providing material support to countries that need such support. And we are working with international pharmaceutical companies to seek and develop a vaccine for this pandemic, and we hope that we will be able to succeed soon in order to provide people around the world with the ability to defend themselves against this pandemic. With regards to our domestic policies, the Kingdom has adopted a whole-of-government approach to dealing with this matter. We have a committee headed by the Minister of Health that includes more than 20 other departments in our government, and they look at everything. They have increased our ability to test. They have increased the number of labs. We have mobile labs. We have drive-through labs that conduct testing to all of our citizens and all of our residents. We have increased the capacity in our hospitals. We have increased the capacity in terms of our ICUs and increased the number of respirators that we have. We were able, thank God, to flatten the curve. In early July, the total number of active cases in Saudi Arabia exceeded 60,000. Today, the number is below 10,000. The number of infections in early July reached over 5,000 cases per day. Today, it's down to between 300 and 400. And what is very optimistic from our perspective is that the number of recoveries are beginning to exceed the number of infections. We will continue to do this. Our schools are virtual. We have restricted foreign travel until January 1 of next year, and we are looking at ways to see how we can open up gradually in a way that doesn't provide harm or jeopardize our citizens or our residents. And we are working with our friends in the international community to see if we can come up with procedures or protocols where we can manage this gradual opening in a way that doesn't contribute to a second or third wave. We are committed, in conclusion, to working with the international community, to working with our G20 partners, to working with the World Health Organization in order to deal with this pandemic, because we believe that what is required is a global effort. And I want to once again thank President Macron and the Republic of France for hosting this important summit. And we look forward to working with you, and we look forward to the day when we overcome this pandemic and life returns to normal and we're able to resume economic activity and trade and travel. Thank you very much.
Saudi Arabia's Foreign Affairs Minister there, wrapping up some of those very important government voices in terms of what needs to be done and how much more there is yet to do. We're going to listen now to a few voices representing those international organizations who are directly involved in ACTA and its implementation. We're going to start with the Executive Director of the World Bank. I asked her a short while ago why equitable and global access to vaccines was so important.
Thank you for your question. Ensuring global equitable access to vaccines and therapeutics for low-income and middle-income countries is a priority, because it is only through this access will these countries be able to alter the course of the pandemic, save lives, rebuild livelihoods, and recover their economies. And without doing that, there will be a loss of decades of development gains, as well as a rise of poverty in these countries. Our experience with the eradication of polio and other infectious diseases tell us that without support, these developing countries can wait for many, many years before they can access vaccines. Therefore, this is why we have launched our vaccine financing program worth $12 billion to ensure that developing countries, low and middle income countries, can access and deploy vaccines. With this program, we hope to be able to vaccinate up to 1 billion people. We are working closely with partners, the UN agencies, CEPI, and Gavi and the ACT Accelerator and the COVAX facility, as well as countries themselves, to be able to give support, financing, as well as technical support to access and deploy vaccines, therapeutics, as well as diagnostics on the ground. I just want to emphasize that we are not just helping or providing support to countries for accessing the vaccine, but also to deliver the vaccination program itself. And this is about setting up the infrastructure and the delivery systems on the ground to be able to vaccinate at scale as well as at speed. And in terms of the ACT Accelerator and the COVAX facility, the World Bank supports fully this COVAX facility because it is intended to provide global equitable access to vaccines, therapeutics, and diagnostics to the poorest and most vulnerable countries. And therefore, through our financing, we are giving countries the options to choose the best way they can access vaccines as well as ensure their delivery, including the COVAX facility. And we will be working with COVAX facility, with Gavi, to ensure and enable that countries can be best served to be able to access these vaccines in an equitable way, and hopefully in a timely way, because I think early access is also the other important issue if we are going to be able to alter the course of the pandemic and therefore rebuild lives and livelihoods and economies. Thank you.
The executive director there of the World Bank, reminding us of those several pillars, of course, that are at the heart of ACTA. There's, of course, vaccines, there's therapeutics, and there's diagnostics. We're going to hear now from Seth Berkley of Gavi, sort of one of those institutions that is really implicated in the vaccine side of the problem.
Gavi is the co-lead of COVAX, the vaccine pillar of the ACT Accelerator, along with CEPI and WHO. Our goal is to accelerate the development of COVID vaccines and ensure that people in all countries get rapid, fair, and equitable access, regardless of their ability to pay. Without COVAX, there is a very real danger that the vast majority of the world will go unprotected, allowing the spread of the virus to continue unabated. This would not only prolong the crisis, the human suffering and economic misery, but also threaten peace and global security, with the risk of sporadic civil unrest and violence increasing each day. COVAX solves this by bringing nations together to work towards a solution that benefits all. With 186 economies now involved, representing 90% of the global population, the initial aim is to make 2 billion doses available by the end of 2021, enough to protect high-risk individuals in countries across the world. But now we need the world to rally and fund the lower-income country support mechanism, the COVAX Advanced Market Commitment, to make this possible, enabling people in the world's poorest countries to get the same access to these vaccines. That's in everyone's self-interest, because no one is safe until everyone is.
Seth Berkley there on Gavi and what it's doing about vaccines. And we're going to turn now a little bit more to the therapeutic side. We're going to listen to Marisol Touraine speaking for UNITAID.
Thank you, Melissa. UNITAID has been working for 15 years to improve access to health for people living in low and middle income countries. For instance, We provide millions of tests for $1 each only. So we have been involved in ACTA since the beginning as co-leader of the treatment pillar. The presence of the world's leaders today gives me great hope, because we need their commitment against COVID-19 and to defeat the diseases that strike the most vulnerable populations all around the world. I want to share with them two messages. First, to defeat COVID-19, yes, we need vaccines, but we also need treatments and diagnostics alongside them. I somehow feel the hope that the vaccine will be the solution is excessive. And I solemnly ask the heads of states and governments to reinforce their support to research for treatments and diagnostics in addition to vaccines. Secondly, I want to recall other diseases that still claim millions of lives every year. In 2020, tuberculosis will kill at least as much people as COVID-19 in silence. I ask world leaders to maintain their commitment to end HIV, AIDS, TB, and malaria, and support multilateral global health organizations to turn the dream of a safer and healthier world into reality. We all count on them. Thank you.
Marisol Touraine, bringing us to the end of this look at where ACTA is, how much has been achieved, and how much further there is to go. Thank you very much to all of you who followed this discussion and been with us today. I'm going to hand back now to Justin, who's going to wrap up this second day of the Paris Peace Corps.